So welcome back. As mentioned, we are here today, tomorrow, and Wednesday for the Wellness and Health Expo. I'll tell you this, the start time is from 9 a.m. and we go till 7 p.m. And you get a chance to talk with stakeholders, like the stakeholders who are sitting here with me this morning. Very important conversation ahead because we are, dealing with the times we find ourselves in. This is the modern times. We are up to the time, and people book so many different things online, and you can now do that as it pertains to your medical professionals, and you could, of course, get your appointment. Hal Mohammed, the regional manager of RioMed Trinidad Limited, is here with me to give us some more details in that regard. So, Mr. Mohammed, great to see you.
Morning. Thank you very much for having us.
Good morning. And with us, the very acclaimed Dr. Adele Springer. She is someone who will guide us this morning as it pertains to pain management, also under the RioMed Trinidad Limited umbrella. And by all means, we welcome you, Dr. Springer. Great to see you.
Good morning, Jason.
Good morning. I want to probably start with the overview, really, of the business model first, and then I want to get into that very important discussion on pain, because pain management and those who treat and deal with that, trust me, you'll get many a question this morning, I'm sure, during the course of the expo. But in terms of what you're bringing to the table, it's a portal, it's really a place where folks can go to, I guess, engage with health professionals.
Sure. So we've been delivering digital health solutions up and down the Caribbean for over 15 years now. And we really saw the need for a patient-centric model, something that allowed patients to view their health care professionals online, be able to book appointments, allow them greater access to their own care, be able to communicate with their doctors, somewhere to store their own medical records, their letters, their prescriptions, certainly as well if you're booking for other people and you need to be able to quickly pull up records for granny, grandpa, and so on, and access to new types of services such as Dr. Springer's services.
And this is called Cellmaflex, what you're doing.
This is Cellmaflex. This is our new product. We have over 1,000 patients who are already signed up to use the service, totally free for patients. And we've got over 350 medical services, and it's also free for them to log in and sign up.
I want to get some details in a few concerning registration and how folks could get involved. Let me bring Dr. Springer into the discussion. You are the, well, as mentioned, perioperative medicine and pain management specialist, as it were. Could you give me some details as to this? Because first time I'm seeing the particular phrase on word. Could you give me some more details in that regard?
Exactly, Jason. And this is why I have to thank Hal Mohammed and Cellmaflex for their good work here in trying to open up the whole of the Caribbean to recognizing new services that are about. Actually, perioperative medicine has been around for over 20 years now. And it's a quality of care perspective to patient care, where we can personalize our service, and make it proactive, looking at risks and complications of the surgical patient. So I'm an anesthetist, so I normally see patients for their surgery, anesthetize them and look after them afterwards. But this is a more in-depth approach that prepares the patient in a more holistic way, psychologically, socially, seeing what they actually need and what the family needs. And then after they've had their surgery, it's also looking after them afterwards for the 1 to 2 months afterwards, making sure that there's no complications that arise.
Doc, I want to ask you, because based on the info, 1 in every 5, that's more or less the start in terms of those who suffer with pain. And I know many people who go through painful experiences, whether it be post-surgery, some particular ailment, some part of the body is hurting, they probably start taking meds. And then some people get hooked on the said medication, and we have seen that being a real issue in places like the US and the UK and other established countries, and I'm sure in the Caribbean we go through the same. How could we steer the patient away from that kind of addiction?
Well, exactly. This is where pain management and perioperative medicine come into effect, because we're looking at the patient beforehand. We're looking at the different, you can assess what is wrong. Maybe there are reasons why they might be addicted. They could have a psychological problem. They may already be on pain meds for something else. They might be depressed, anxious. All of these other factors go towards that they might have a risk of being addicted in the future. So we can check for that. And also we're looking at afterwards how long have they been on the medications? Maybe they don't need the medications, maybe their pain levels are not so bad that they need to be on strong painkillers, all of these sort of things. And I mean, we've even seen, not even talking about strong painkillers and opioids, I've even seen patients who have been on simple non-steroidal anti-inflammatories for a long time after their surgery, and they've come up with complications afterwards, even things like bleeding and things like that have caused problems. So it's something that can be prevented. It takes time.
Yeah.
A lot of my patients, I see them for a long time, an hour, 2 hours sometimes just for one patient. So yeah, that's what we do.
I want to thank you, and we'll come back to that discussion in a few. I want to bring Hal back in because we mentioned this portal, this particular place where one can go now to engage with medical professionals like Dr. Springer and others. Walk me through the process. Is it an easy process in terms of going on, logging on, registering? What's required for this registration?
Connection to the internet. We're trying to make this as easy as possible for all of the patients. We've got, all of our doctors have got QR codes that they can send out and scan. They've got links for WhatsApp. You just visit Cellmaflex.com, you put in your email address, and you're registered. And we can send you regular updates. You can go online, search your medical professionals, whether they be doctors, dentists, your lab services, any of them, and then new medicine such as pain medicine that's come very new to the Caribbean, but as Dr. Springer says, an established medicine elsewhere. We try and make it as easy as possible. And we've got some great giveaways at our booth as well today for both doctors and patients, and throughout the 3 days of the exposition.
This is, I could only imagine, probably one of the most requested booths here at the Expo, because let me tell you, pain. I mean, I literally, as I sit right now, I'm feeling a little something in my back, Dr. Springer, but we'll talk about that later. We'll talk about that later.
Come see me.
But tell me, what you want people to, at least from your personal perspective, what you want the biggest takeaway to be when they come visit your booth at the Expo?
Yeah, well, again, I have to thank UHealth for having this Expo, because this is one, as a member of the International Association of the Study for Pain, one of our directives is to spread the word about pain awareness, because it's such a global problem now. As I say, between all of us that are here, there's at least a few people that are in pain, and it's causing an increasingly social and economic problem. So I want people to come and be aware that there are people trying to help chronic pain and the difficulties that are in treating it. And I want them to know that there are services in Trinidad. There are other pain specialists as well now in Trinidad. And hopefully we'll be able to outreach the rest of the Caribbean as well with it as well.
And I'll let Hal have the final word, but what I'll say and add to that, Dr. Springer, is that it's so important to meet with medical professionals like yourself and really get that guidance, because so many times people tend to, do their own self-analysis and probably go to substances sometimes to numb the pain, but that's just a temporary ease.
Yes.
It will persist after whatever you're taking is off. So very important to continue and to have that consultation. Final say, Hal, it's all yours.
Yeah, so if you are in chronic pain and you do want to book an appointment with Dr. Springer, you can visit her booth. She also has her QR code on our booth, where you can just walk past, scan the QR code, it'll take you directly to her page on Cellmaflex, and you'll be able to book an appointment with her. There are a number of other healthcare professionals who we're partnering with, particularly for this exposition, and they'll have their QR codes on our booth. And as I said, we've got plenty of giveaways. I'm feeling very, very generous this morning. I had a hole-in-one on the golf course yesterday. So we're looking forward for today.
Excellent. Thank you so much, Dr. Springer and Hal Mohammed, touching base with us. By all means, the Expo continues. We're going to come back after the break with more, I would say, impactful conversations. Remember, we start at 9 and they go until 7 p.m. This year, UHealth and Wellness Expo 2024. See you soon.